everybody, welcome back to my channel. Okay, I know it's been a super long time, but regardless, we're just gonna get straight back into it. And the lighting is absolutely terrible. I have half a light face, half a dark face. But again, we're going with it. So, today's video, after the popularity of my like HCA video, I'm gonna do the truth reality of the NHS. Telling you more of an in-depth into like the pros and the cons of working for the NHS. So let's get started. Okay, so once again I have my notes on my laptop this time instead of a notebook. I am once again in my HCA uniform without the fob and the badge, just because. And my hair is pretty much how I would wear it for work, up in a ponytail, with some interesting elements, just because, you know, why not? Speak of the devil, let's have a siren, just because we're talking NHS. I forgot how annoying sirens were in interrupting me filming. God. So this video is from a nursing, OT, kind of allied health professionals perspective. The people who work at the very, very top, like the board of directors, and even people who work in sort of other departments like pathology, pharmacy, even reception desk, will have a probably completely different experience. But this is the kind of healthcare full-on, front, hands-on patient, I think, type experience. First of all, our favourite topic, let's talk money. Okay, so the pro, discounts, heck yeah. Okay, so I have what's called a blue light discount card. This video is not sponsored by them. I think it's like £5 for 4 years or something along those lines, and it's great. It literally is like an NUS card, but for like NHS workers. It even actually works for people like police, fire people, all of those kind of types. You can get it. It works in places like Go Outdoors, Costas, Starbucks, Cotswolds. It works in like the cinemas. It works in some like restaurant chains like Frankie and Benny's. Also in a lot of like, if you, for instance, in York, they'll do a lot of discounts in the city in private, like independent places if you show your NHS card. So there is a brilliantly plus side, and it's the discounts. However, I mentioned salary for HCAs, starting salary for like OT and nursing staff and anybody that's on what's called Band 5. So as a just graduated professional, you'll be called a Band 5, like physio, Band 5 nurse, or OT. Don't ask me why it's Band 5. Below Band 5 is like non-university qualified by 3-year degree type trained. Still trained, but not 3-year degree. For instance, as a HCA, I'm Band 2, I get paid just under 10 quid an hour. I feel like starting as a Band 5, it's like 24,000, starting Band 6 is like 30,000, starting Band 7 is I think 39,000, and starting Band 8 is I think 45,000. However, the number of people that are Band 8 is very, very small. Most people who you would see in the hospital, such as nursing or physio, will generally be Band 5 or 6. But that is the salary. Things that you probably don't occur in other professions. Teaching aside, where you can choose to pay into a union for like support and in terms of like strike and all that jazz, and probably more than that, but that's all I know. And aside from things like, well, for instance, as an OT, I can choose to pay into Unison for insurance cover in case someone puts a claim against me. Other type insurance people, or I could choose to go through RCOT. RCOT stands for Royal College of Occupational Therapy, which give me like help and advice and also insurance cover. That's optional. Most people tend to go with some level of insurance. I have to pay to work the HCPC registration membership. Now, for other professionals like nurses, they have the Nursing and Midwifery Council. I know pharmacists have one that's different, and I know doctors/consultants have one that's different. The Nursing and Midwifery Council, as far as I can tell, is £120 annually. I think that's how much it is. So that would mean it's 240 quid for 2 years. For OT, for the HCPC, for so physio, speech and language, OT, there's other professions under it as well. they have to pay, their current fee is £90 per year, so it's £180 for 2 years. And there's some differences in terms of if you are newly qualified. But that's something I have to pay, so I already am taking off money that I have to pay just to enable me to work. Pros and cons. The other thing to mention is uniform costs. So I'm currently in my uniform, and while generally hospitals will supply uniform, not every healthcare professional wears uniform. Nurses and in the community and consultants don't tend to wear uniform, but those that do, you also then generally have costs of washing your uniform. So while I didn't have to pay for this, there is an expectation that I will wash it after every shift at 60 degrees to kill as much bacteria as possible. And for instance, I only have 2 uniforms, or 3 even, but that's a lot of washing if I'm doing a full day. A full working week of 5 days a week at quite a high temperature. And while if you are a professional wearing any type of uniform and you incur the uniform costs, you can claim some tax back, so that's police and everybody. I'll link in the description box below more information. It's still a cost that you have to outlay. Additionally, if you're community, you have to outlay your petrol, but you do also get it back, but there is also that initial outlay. So financially, there's pros and cons, depending on A, of your hospital, B, of your community, etc. I will also quickly mention there is the NHS pension, which I believe after speaking to people it's pretty good. At the moment I'm not paying into it, but I will when I get a full-time job. And it's just like anything though, at the moment it's good, but come 50 years time, maybe even 60 years time at this rate, when I retire, if I ever get to retire, it might not be very good then. But there is that. Okay, so other harsh reality is your emotions are going to play absolute havoc with you, probably at least once a month, potentially, unless you're really hard and like, butch, like, Arr! No, once a year maybe. But the truth is that you will get emotional at some point during your job about a case. You might have been working with that person and they might have passed away and you might be really sad about it, or you might be working with a person and, for instance, community, they don't show up or they're not there and you get frustrated. But your emotions play a big part of who you are, and as a healthcare worker you have to not let them influence your practice. And that's the harsh reality. You at work, regardless of how you're feeling, of how you're feeling physically or emotionally or mentally, and regardless of how kind of the situation occurs in regarding to a patient, you have to not let that influence your practice with other patients. And while like your staff might be empathetic if you've got a really bad headache, the truth is your patients, just like if you're a customer at a restaurant and your waitress is really sad and not in the mood, same with patients, but they're really vulnerable at this time in their life, and you know, it's just not good. So you kind of almost have to be non-human, is the best way to put it. The other thing is it can get actually really scary sometimes, working for the NHS, depending on, again, this is mainly patient-based. I'm sure kind of people, the pathologists that looking at blood sample cells and testing them don't have this experience, but those that work directly with patients, it can get pretty scary, especially in A&E in regards to your own personal safety, as well as in community as well. Okay, so I did mention shifts and sort of time patterns in my last video, but I'm going to mention it again. The truth is that if you're working as a nurse, midwife, consultant, doctor, HCA, anything like that, where you need to be there to ensure the care of the patients is 24/7, the chances are you'll be working night shifts or long days, so that can mean like 8 p.m. till 7 a.m, 7 a.m. till 8 p.m, or kind of shorter shifts during the middle of the day if you choose and can do. However, as an OT, so for instance physio who get people up and out of bed to do exercises, they're not going to do that during the night, and it's really important patients actually rest as well. So in that perspective, OT, physio, speech and language, anybody kind of somewhat similar to it, so taking patients' bloods, if you're a pathologist, or x-ray, well, even with x-ray though, you'll be there for A&E overnight, but that kind of thing, you will not be over the night, and you'll potentially work sort of like 7 till 5 or 7 till 6, in between those times, potentially 7 till 6, but in between those sort of hours, you'll generally be working. Finally, the harsh reality of training. Okay, you have to do, I know, to be a nurse, OT, physio, doctor's insane, 5 years is, well, I mean, it needs to be, but you have to do 3 years at uni, and the chances are you'll learn more in the job in 3 weeks than you will at a whole 3 years at uni. The other thing to mention is that while you're doing things like manual handling training, the truth reality is that you'll be working with an able-bodied person to learn these things. So for instance, for my training for work, I did moving and handling using a hoist. I have used a hoist loads of times on my job, in my training, for both uni and hospital, and no time has been exactly the same. During training, the chances are I'm working with either another person like myself or the actual trainer. So they'll be pretty able-bodied, they'll be able to bend their knees, they won't be quite so scared because you know you're in safe hands and you know what to expect. Patients, on the other hand, completely normal for them to be like this, will potentially not be able to bend their knees, potentially be very shaky, very stiff, very rigid. And the truth is, no matter how much hoisting you do, how much training you do, every patient will be completely different, and that is just something you have to accept and be very quick at thinking on your feet. I had a patient the other day who we were hoisting and they couldn't bend their knees, and it made things incredibly hard to position them, and they were also incredibly scared, and I had to very quickly think on my feet how we could position this patient safely in bed and make sure they had the least time in the air in hoisting as possible. For A, safety, and B, they hated it, really hated it, and as a result I also had to think, how can I calm this person down? Something you don't have to think about during training in a very controlled environment where the person's pretty relaxed swinging away in the hoist. But that's just hoisting, but it's the same with anything in regards to any moving and handling, any training in fact, any training for anything, potentially, when it includes people, it won't be the same as how you trained. So the harsh reality is you will never feel 100% sure with what you're doing, and that's just something you have to accept. So that's all my points for this video. If you have any questions or you want to just say something to the general public out there, do post it in the comments below. I will try and ensure they are live instead of disabled. So many videos are disabled at the moment. So yeah, do comment them down below. It'd be really great to hear from you. Give this video a thumbs up, and I will potentially do another one if I can think of any more points. Thank you for watching. Bye!